It was difficult for me because to apply for health insurance, either you have to pay for it at your job or you would have to get Medicaid, and I wasn't eligible for that.
You know, a trip to the emergency room is not something that everybody has a savings account waiting to pay for.
One of the biggest things that I worried about was winding up in the hospital and getting buried with a hospital bill and losing my house. For
many years, I was afraid of going to the doctors and finding out what's going on, because then I wouldn't have nowhere to take care of it.
Trinity Health envisioned a nation with an affordable healthcare system that left no one behind. In direct alignment with our mission and values, our insurance coverage expansion advocacy, outreach, education, and enrollment efforts have been embraced by our regional health ministries in communities across the country. Collectively, we assisted nearly 300,000 individuals the first year health insurance exchanges were operational. To our Trinity Health colleagues in communities nationwide, it was clear that our focus on coverage expansion would have a vital and lasting impact on those who are poor and vulnerable. Leaving the four walls of our hospitals proved key to bringing healthcare access to people in our communities.
A lot of people that we see in outreach do not have insurance. They don't have Medicaid. That's gotten better with the Medicaid expansion, but many people aren't aware that they're eligible, and we steer them in the right direction and tell them, even if they weren't eligible a couple years ago, that they probably are now.
I was in a homeless camp, and basically DOCO came into my camp, and I had a blood pressure of 210 over 140, and then if it wasn't for Mount Carmel, I'd be dead now.
It was probably easier to reach you when I was in the shelter, but when I went to the tent in the field, it's not so easy to be found.
But we came to the tent too.
Sure did. More important than the simple health care provided by having insurance was, like, I learned how to be responsible. I learned how to be patient. I learned how to take some direction so that I could, get out of that sense of apathy that being in the streets was going to be where I spent the rest of my life.
Young people, like Kenta, normally don't think that they're going to end up like this, right? Because they're young, healthy, and brave. But when you think of the risk, it just is not worth the risk.
The people in the enrollment center were really friendly. And if I had any questions, they would go ahead and answer them. So it was really comfortable to be there.
She made sure that I got my medications because I was having a problem getting them. She opened that door, and she opened the door for transportation, and her and this program changed my life.
I need that insurance. I've worked all my life too, and I need it at this particular moment until something better comes along. There's so much negativity, and I see nothing negative about it.
No preocupaciones, no tiene mortificaciones en aspecto de su salud. No, none referring to her health.
It kind of gives me a peace of mind that if something does happen, if I do become ill, then I'll be able to get treatment.
It's working the way it's supposed to work. You had a plan in 2014, you want to re-enroll in the same plan or choose another one. It's such an easy process to do it.
That worry that I used to have about, wow, I have to get medication. Wow, I wonder how much the doctor's going to charge me. You don't know the alivio, we call it in Spanish. You don't know the feeling that it takes away, the stress. I don't have to go through that. My life is just starting at 51.